Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender adult care. Welcome to my channel. If you have not had chance yet to subscribe, I would very much appreciate your subscription. It helps me very much in supporting my content. It also helps a lot of other people find the content. So if you are a fan of my content, the best thing you can do to support me is to subscribe, like, and comment on the videos. All of the things help everyday changing algorithm on YouTube. So I would very much appreciate that. Today I want to talk to you about one of the very big scary truths about gender dysphoria in adults. And I think talking about more subtle, I would say subtle, invisible handicap elements of struggling with gender dysphoria is important. Not only is it important for other people to understand the complexity and nuances of gender dysphoria, but I know that for a lot of you, hearing a more nuanced understanding of how it is affecting you also further can help you. So let's talk about the scary truth about gender dysphoria and what do I mean by that. So I know one of the things about gender dysphoria in our culture today is that we're so accustomed to still carry an old dogmatic narrative. The gender dysphoria is excruciating, so excruciating indeed that individuals just want to mutilate themselves in order just to get rid of the body parts that not align with them. And while that is undoubtedly true for some individuals, I find that actually gender dysphoria that is less extreme in severity is much more prevalent. And one of the reasons why it's much more prevalent is not because people somehow feeling lesser form of it, but because we live in a world where it becomes much more easier to distract ourselves, to avoid confronting the feelings of gender dysphoria. I would even argue to say that for a lot of you who feel neutral, mild, a little bit higher than mild gender dysphoria, that you're actually feeling it by 2 to 3 to 4 degrees higher. But you're not in touch with those feelings because, again, we live in a world where it's so easy to avoid how we feel. We're inundated by social media, we're inundated by access to technology. All of those things remove what in the past we would have, which is a space to sit quietly with oneself, to introspect and contemplate on feelings. And that has been filled and replaced with constant scrolling, all of those things you do technologically, listening to podcasts, watching television, TV shows, you name it. And it's easier to avoid acknowledging how one feels. This is why for a lot of you who are watching this, the times when you actually feel a very strong presence of gender dysphoria is going to be during the times when you have to confront your physicality, coming out of the shower and looking at yourself, intimacy with your partner where you have to be naked and vulnerable, changing your clothes in front of a mirror, getting ready for work and looking at yourself in a mirror. The minute you are confronted by acknowledging the body container, oftentimes is the minute when one feels an increase in gender dysphoria. And because it is so easy to avoid how we feel, the actual capacity how one feels tends to be perceived as much more decreased than it actually is. The scary truth about all of this is that it leads to a lot of you to not only avoid feelings, but also while you recognize either something is going on or I'm aware I have gender dysphoria, to then avoid doing anything about it. And the reason why so many of you avoid doing anything about it, no matter how small, seeing a gender therapist, clarifying if you do in fact have gender dysphoria and what does it tell you, finding out what your gender identity is, taking steps, maybe stepping into some element of transition. One of the reasons why a lot of you prevent and avoid doing that is not because you don't want to. It's not because you love your assigned gender. It's not because you're comfortable with your assigned gender. It is because you're not in touch with the feeling, the stronger element of discomfort. And this is a scary truth, because when you're not in touch, or not in touch, I would say, to that higher degree, you're more likely to tell yourself, I'm going to wait to do anything about my gender dysphoria until I can't handle it any longer. Does that sound familiar? I bet for a lot of you, you're doing that exact thing right now, or a lot of you have done that in the past. I'm not going to tell my partner until it gets absolutely worse and I can't handle it. I'm not going to tell anybody. I'm not going to seek gender therapists. I'm not going to seek any support services until it gets to the point where I absolutely cannot tolerate it anymore. Somehow, we live in a world that not only perpetuates a lot of times a shitty, stupid narrative that suck it up and deal with it, especially for a lot of individuals who trans femme, who were assigned male at birth and went through the history of upbringing where you've been told stereotypically as little kids growing up, as boys often do, suck it up, hide your feelings, don't show how you feel. So not only do we have a byproduct of culture of individuals who are men who are not in touch with their feelings. I'm not saying that that's for everybody, but for a lot of men are not in touch with their feelings. We have a lot of people who on top of that are struggling with gender dysphoria. And now it's that much more harder to get in touch with feelings. And so this idea of I gotta be Superman, and again, I'm referring to individuals who were assigned male at birth. I gotta be Superman and I gotta suck it up and I gotta deal with gender dysphoria is the ugliest, it's the scariest and the ugliest truth about gender dysphoria, because it strips you away from opportunity to do something about it. And it prolongs your suffering, and it increases possibility of regret later in life. A lot of you also have mentality of, I gotta fix it, I gotta fix it. It's a problem to solve, I gotta fix it. How many times do I have to say gender dysphoria is not something that you can fix, as if you can fix a mental problem? If it was fixed in such a way, people wouldn't have to go through other external changes in their life. So this is the biggest invisible handicap about gender dysphoria that a lot of people don't understand, is its capacity to get a notch lower in its intensity, because we're so distracted and disconnected from our feelings. For individuals who were assigned male at birth, it's especially difficult because already there's probably a cultural component for a lot not to connect to their feelings. And so as a byproduct, a lot of people feel gender dysphoria, but keep telling themselves, I'm going to do something about it when it's going to get really, really bad. Another thing which falls into this invisible handicapness of gender dysphoria that a lot of you don't tend to think about. And that is when you have gone through decades of living with gender dysphoria, even though it's hard, even though you don't like it, but you have learned and you got habituated to avoiding it, avoiding dealing or confronting with it. You start telling yourself a lie. Well, maybe I can avoid it until I die. Maybe I can avoid it for the rest of my life. Or maybe I can avoid it long enough, and this is the scariest lie, I can avoid it long enough until one day it's just going to vanish, it's just going to disappear. And while gender dysphoria over time doesn't necessarily get drastically worse for everybody, it doesn't go away either. It may be reduced a notch down depending, in my experience, on the coping that you utilize. But it doesn't just go away. And so this inaccurate kind of like a bias you tell yourself that, hey, look at this, it's been 15 years. What's 15 years more? Gets you in a position where 15 years passes and now you just cannot deal with it anymore. And now you regret because 15 years of your life have passed. There's so much more that I'm not even stressing in this video about gender dysphoria that is so nuanced and so invisible to a catching eye. For example, this is why for those of you who are in relationships, when you tell your partners, why a lot of your partners feel like, no, I'm giving you ultimatum, you can't just deal with it. It's going to go away or just, deal with it. The reason why they have ideas, just deal with it, because they witnessed you living with it for a decade. And so your partner, understandably so, thinks, well, if you lived with it for 10 years, why can't you just live with it 10 more years? That's it's such an unfortunate thing about gender dysphoria. It's not, I was just looking to a client of mine that unfortunately it's not like cancer, right? That if you live untreated, you die. It just gets progressively worse. Gender dysphoria, if left untreated, may get progressively worse for a lot of people, may continue, remain the same, may slightly decrease, but still remains there. But people still find a way to live through it, albeit it's very challenging and very difficult. A lot of you already know this, how much energy and strain it takes you to be able to cope, even to be able to avoid thinking about gender dysphoria. And this is the most challenging thing about it, is that there's such an invisible aspects of it, the nuanced aspects of it, that then become a very significant patterns in the way you think and the way you conceptualize what is happening to you. So I want you all to be very careful if you are now watching this and you're saying, you know what, I'll just wait until it's going to get really worse to do anything about it. I, as you know me, always preach that doing something about gender dysphoria doesn't have to be full-blown surgery. I also don't think surgical transition is for everybody. But I do think that starting to acknowledge and even having conversation with somebody, even starting to letting this tension outside, does tremendous amount of good. It helps you so much better in your daily life. It helps you to be more present, more productive. It helps you in so many other ways. And there's other tiny little steps you can take. And a lot of people who take little steps, for example, I have a lot of people who work with me who take little steps, who never goes through full transition. Full transition, I mean, first of all, what is even full transition is? Let's just say it, individualistic transition is individualistic. It's up for people to decide. But I know for a fact that living in avoidance of confronting gender dysphoria, living in avoidance of confronting what is happening, is also not going to lead you anywhere. What it's going to do is it's going to perpetuate the history you experienced up to this point. And if your history up to this point is that of living in distress and anxiety and having a hard time connecting to yourself, you're going to just have more of that. Again, nothing is going to change unless you're going to change. So comment below. Let me know if you are one of the viewers who might be waiting. I'm just going to wait until it's going to get really bad to do anything about it. Or are you one of the viewers who is hoping it's going to suddenly vanish? Or where are you in this whole experience of your struggle with gender dysphoria? Comment below, let me know. And I'll see you all next time. Bye.